name is Amanda Harris. Student ID is 2965277. This is my AVMA video for veterinary nursing, VTHT 2439, fall semester 2018. We're going to begin our physical exam by listening to the heart and lung fields on both sides. Lungs should be clear. Heart should be a strong sound with no any swooshing sounds that indicate that there could possibly be a heart murmur. So, this is my dog Murdoch. He's going to be an example for a lot of my videos. So we're going to start by listening to the heart. That sounds good. A little bit hard with his panting, so we're going to try and hold the mouth shut. Alright, now I'm going to calculate the beats per minute. So when I'm doing that, I'm going to find the heartbeat, and then I'm going to count how many beats he has for 15 seconds and multiply it by 4. Okay, so that's 17 beats that I counted, and we're going to multiply it by 4, which is 60. So that is a regular heart rate. We're going to be doing an ECG on this dog. Place our monitors on each leg. Left arm. Right arm, apply alcohol. Right leg, left leg, and apply alcohol. You always want the patient in lateral right dependency. And you can see the results on the screen. When doing an ECG, you want to minimize artifact the best you can, and by doing that you would keep your patient from shivering or moving, and you want to be sure that your patient's not touching anything metal. I'll be demonstrating the use of a restraint pole or rabies pole. You always assume that the dog's going to be aggressive if you have to use this. We're just using my dog to demonstrate. You pull back on the handle to tighten it, and you can push it forward to make it a larger loop.
Nice.
We'll slip it over the head.
Nice.
And then we'll tighten it.
Nice.
Alright?
Good job.
Okay. Alright, we're going to be trying to catch urine sample. We're going to be walking this dog. About midstream, we're going to set our urine cup and collect some. Come on, buddy. we've got our urine sample. It's important to remember that when you're free catching urine, you want to catch midstream so that the first part of the dog's stream has flushed out any bacteria that might be around the pre-pubes. The midstream is going to be the most viable part of the urine that you want for your analysis. I'm going to be demonstrating how to properly disinfect a kennel. We're going to be using a trifectant solution. We're going to spray all 5 walls and allow it to sit for up to 10 minutes as directed on the label. And then we're going to wipe it down. Alright, we've allowed our trifectant to sit for the recommended amount of time. I'm going to wipe down all the sides of the walls, including the ceiling. The amount of time that a solution needs to sit in the cage before wiping down just depends on the brand of cleaner you're using. Alright, we're going to be demonstrating how to collect urine via urinary catheter. First, we're going to set up our sterile field. So I've got our sterile gloves here. We're going to open this up without touching the inside of the packet. We're going to place some lube jelly into the sterile field without touching the field itself. We're going to open up our urinary catheter so it is also ready. Alright, so next we're going to clean the prepubes of any bacteria with just some chlorhexidine scrub. And now we're going to glove up. Where do I stay? Okay. So we've got our gloves. And now we're going to take the sterile catheter, apply some lube jelly to the catheter tip, and begin the catheterization. Can it see? Alright, we've exteriorized the penis and we're going to insert the catheter. Might feel a little resistance there as we round it to the bladder. We're going to continue to feed the catheter until we start to see some urine come out. Okay, there we go. Tech is going to hand us a sterile syringe. There we go. There we go. Okay, and we're going to remove the catheter. Like so. Okay. Alright, Alright, we're going to be performing a cystosynthesis on this cat today. The bladder is palpable, so we won't need to use an ultrasound. There we go. I'm going to be demonstrating how to perform a shimmer ear test. So we've got our tear strip here. It just says on the back there the tear test strips. We're going to place this in the dog's eye, and then for a minute we're going to count how much tear production he's making to determine whether we're dealing with something such as KCS or dry eye. Stay. So we're going to bend the tip here and place this in the bottom eyelid, like so. So we're going to pull the eyelid down, place it in there, keep the eye shut, then count for a minute. Alright, we're past a minute, and his tear production was at 20, so he has a normal result. Alright, I'll be demonstrating how to take the pressures of a canine's eye with a tunnel pin. First, we're going to apply some proparacaine to the eye. We're going to let that take effect before we check the pressures. So here we have our tono pin with a cover. Ours comes already calibrated, so we don't need to calibrate this one. The reason we would be checking pressures is to either rule out glaucoma or diagnose early glaucoma. Alright, so we've allowed our proparacaine to take effect, and we're going to be checking the pressures now. I want to make sure that we don't hold around the neck. You're going to get spanked on video. We've got our first one there, and we'll want to recheck it just to verify that it's accurate. There we go. So he's got a normal range. We're going to be performing a fluorescent stain on little Miss Heidi here, checking for any scratches or ulcers. So we've got our stain strip and our ophthalmic wash and a Woods lamp. So we're going to apply a little bit of the ophthalmic wash to the stain strip. And then apply the strip to the eye. No, baby. We'll do a little rinse to rinse out any excess. Okay, now we're going to examine the eye with a Woods lamp. Nice and clear. Now we're going to flush the remainder of the stain out of the eye. Okay. We're going to be expressing this dog's anal glands today. We've got our gloves, our petroleum jelly or lube, and some chlorhexidine wipes to clean up afterwards. We're going to insert our pointer finger about first knuckle, and the anal glands are on both sides at 4 and 8 o'clock. If they're really full, you'll have to sit there and massage them for a moment. Afterwards, I like to do a final external expression to make sure that we've gotten everything that we can out. If they're really smelly, we can also use some waterless shampoo if we need to. Please don't. We're going to be making the solution for our enema. We're going to be doing a warm water and lube solution. So, and we're going to add some petroleum jelly or lube. We're going to mix this up and we'll draw it up into a syringe. Okay. Alright, now we're going to administer the enema. We'll apply a small amount of lube to our syringe tip. Again, if we had a non-slip tip syringe, we would attach that to a red rubber tube. Okay, and we'll just inject our warm water solution, okay? Alright, we're going to be treating this little kitten here for ear mites. So we're going to clean the ears out real well, and then we'll apply a topical Bravecto to this cap that also works for the ear mites. So we're going to be doing an ear cleaning and a topical application. On cats, I like to apply the ear cleanser to the cotton. Kind of makes them react less. You can also apply it directly to the ear. Pretty good kitten, so I didn't need help. Just trying to get a lot of that debris that goes with the ear mites out. Give the kitten some relief so we're not scratching our ears up as much. Alright. We could also apply a topical ear medication to treat the ear mites, but to help with the fleas, we're also going to be doing the topical Bravecto. So you'll want to part the hair down to the skin and apply the medication directly to the skin. If it's a smaller cat or dog, you can dispense it in a line so that it doesn't all bunch up in one spot. Okay, there we go. Even though we've done the topical Bravecto, I will demonstrate how to properly clean the cat's ears or medicate the cat's ears now that they've been cleaned. So I'm not actually going to apply the Max to the ears, I'll just demonstrate how we would do it. Much like the cleaning, you'll insert the nozzle into the ear, give it a squeeze, and then be sure to massage it in well. And we would treat the other ear, give it a squeeze, and massage it in well. I'm going to be performing an ear cleaning today. I've got my Epiotic for the cleanser, and then we're going to use the Max to treat the ear infection. Good boy. So we'll take the ear, apply the cleaner, massage in well. Remembering that the ear canal is like an L. Mm-hmm. So we want to get it deep into the canal. Now that we have the ears cleaned out, we're going to apply some medication. Same type of procedure, hold the ear pinna up, apply the nozzle of the ear medication, and squeeze the medication in and massage it in well. We'll do the same process to the other ear. We're going to be administering some subcutaneous fluids today on this dog who's got kidney disease. So we're going to just be using Normosil R, no additives. We've got our 18 gauge needle on there so that the fluids go a little bit quicker. We're going to flush the line. We'll insert the needle just under the skin and begin our process. Release the clamp. We don't want to put too much in one spot and have the skin react to too much being there. It can become an abscess. I'm going to do 300, so we'll probably just split this up between 2 different injection spots. As you can see, the skin is beginning to stretch with the fluids. We're going to be performing a nail trim today. I'll demonstrate how to properly clip a dog's nails, and then we'll talk about what to do if we accidentally clip one of the nails. So we want to take the nail and have the clippers parallel with the nail and just take a little bit off at a time. When you're close to the quick, you should see a core, and that's right before the blood supply. If we were to quick, we've got some septic powder, some quick stop here, and that will be applied to the nail like so. And that's how you do a nail trim. If you're doing a nail trim on a cat, you can either use a normal pair of nail clippers or a pair of human nail clippers. They also make smaller nail clippers for felines, but we do not have one of those. So you can see the quick, and you'll just trim a small amount at a time. Making sure not to forget the dew claws. so we're going to be doing a mock emergency bandage. I've drawn on a fake laceration on my dog. We're going to first apply lube to the laceration. Once the lube's applied, we'll have a sterile field. So if any hair from shaving it gets trapped in the wound, we will be able to flush that out. Always want to try and keep everything as sterile as possible. So we've got our sterile lube here. We will apply it to the wound. We've got our clippers, and we're going to clip around the wound now. So we're going to clip around the wound. We've got a chlorhexidine solution scrub already made up. We're going to clean the wound well, while we're also flushing any hair that might have fallen into it out. And now we're ready to bandage it. We've got our cotton bandaging and our vet wrap, just for the emergency bandaging. We're going to tightly bandage this wound to try and stop any bleeding until we're ready for surgery. Like so, with the cotton dressing, and then we'll follow through with the vet wrap. So there we've got our emergency bandage, just a mock one, of course. Now if we're going to remove the bandaging, we want to of course use some bandaging scissors that have the blunt bottom. And we'll stick that under the bandaging and just cut it right off like so. And there we go. Emergency bandage. Today I'm going to be demonstrating how to properly apply a Robert Jones bandage. We're first going to be applying the stirrups with tape to either side of the leg. Hi, Linda. We're going to place our tongue depressor in between and tape place the remaining tape on there until we're finished. Like so. And we're going to start with cast padding. Followed by bandaging material. Followed by vet wrap. We'll take either side of the tape and tape them onto the wrap. And then the last step is just to apply a small amount of elastic onto the top to avoid the bandaging slipping. And there we go. Alright, to remove our bandage, we'll of course need some ease off for the adhesive of the elasticon. And we'll take our bandaging scissors. And we'll just cut directly down, keeping the scissors level with the leg. There we go. So we're going to be applying the splint on this dog's leg. We want to measure it from elbow to the top of the toe, or tip of the toe. We're first going to wrap the leg in some bandaging gauze so that the splint doesn't rub on it. And we'll apply the splint and secure that onto the leg. Like so. Followed by vet wrap. Making sure that it's not too tight on the toes there. Alright, and our last step is to apply a little elasticon at the top to ensure that the splint does not slip down. There we go. Alright, to remove our splint, we're going to want to apply some ease off to the elasticon. Take our bandaging scissors and being sure not to cut the splint, we're going to start down the bandage. And we can take all this out, and if we're going to bandage it again, we can use the same splint. Performing our dental today, so we're just going to start by hand scaling. Just going with the tooth, moving around, making sure that we don't stay in one area too long. Just getting that tartar off, like so. Now we're going to continue with our ultrasonic scaling. Again, not staying in any spot too long, no longer than 3 seconds. Like so. Alright, now we're going to do the last step, which is polishing the tooth, smoothing out any scratches. We're going to take our paste and apply it to each tooth. Okay. So we're performing our dental radiographs now. We're going to be taking a radiograph of this molar back here on the bottom. So we're going to stick our slide here right where the tooth is. Is that good? Mm-hmm. Okay. And then we're going to bring our head over. And it's going to be right above our cartridge, like so. Alright. Alright, and there we have our radiograph of. Alright, for our second radiograph, we're going to take a radiograph of the upper incisors. So we're going to place our cartridge. And we're just using this gauze to stabilize it for the radiograph, like so. We're going to take our head and at about a 30-degree angle, we're going to place it right over the nose. Okay. Is that good?
This one's not even sure. It's a hip boxer mix.
And here you can see we have our incisors with the roots. Alright, today we're going to be going over pork chops and go home. We had a dental done today with a few extractions, so we want pork chop to have some soft food for the next couple days. You can either buy canned food or water it down and let it sit for a couple minutes. We're going to be going home on some antibiotics due to the dental and stirring up that bacteria. We want you to give the antibiotic with food. Sometimes we can see some GI upset with the antibiotics, so if you see any vomiting or loose stool, we'd like you to call us and let us know. Keep us confined for the remainder of this evening. If you notice any adverse side effects from the anesthesia, vomiting, diarrhea, or lethargy, we'd like you to call us at our emergency number here. We've got before and after pictures here of Pork Chops Dental, and we did Pork Chops Rabies today. Do you have any questions?
No.
All right. Home oral care, we recommend these dental care chews or dentist sticks that you can get from the store, and or we can add in oral rinse.